Hello everyone. Good afternoon. I'm Dr. Saurabh Gandhi, consultant pediatrician with Surya Hospitals, Santa Cruz West, and I'm available here from Monday to Saturday from 10 a.m. to 2:30 p.m. Today I will be talking about the importance of immunization. We are very fortunate that in today's time and age, by taking a simple vaccine or by following a regular and simple immunization schedule, we are able to protect ourselves and our children from a lot of harmful diseases and illnesses. So, basically, what is immunization? It is synonymous with vaccination that can be done in the form of a simple injection, that is, your shots or jabs, or not even that is required. Sometimes, even oral drops are sufficient. It is a process by which a person or a child is protected against a particular disease via vaccination. So, how does it work? These vaccines are basically of three types. They can be either live vaccines, they can be attenuated or killed vaccines, or they can be subunit vaccines, which are just small particles of the viruses or bacteria. So, whenever a child or an adult receives a vaccine, that is a small dose via an injection or a few drops, like 2 to 3 oral drops, or maybe 1 or 2 ml of the drops, that time a small amount of the virus or bacteria enters the body's system, that is the immune system of the body, and the immune cells take over. They try to attack these cells. Now, these viruses or bacteria or particles are injected in a dose, in a very small dose, that does not cause any illness to the patient, but it is only sufficient enough to trigger an immune response. So now these cells are activated. They take care of these organisms or bacteria, viruses that have attacked the body, and they are prepared for the subsequent attack which may happen later. So in future, in case these viruses or bacteria invade the body again, then these cells fortunately have a memory which helps them to take care of these infections. So the child does not suffer from that illness. He is protected from the harm caused by the bacteria and viruses, and he is illness free. See, it's so simple. Why fuss over it? I think that we should not worry much about the side effects of vaccines or whether it will cause any harm to the child if you vaccinate. We should just take the vaccinations, encourage others to make their children take the vaccines and remain safe. Why should we vaccinate our children? Now, basically, we should vaccinate our children to protect ourselves and our children from the harmful illnesses that can occur, because many diseases can cause potential life threatening complications. They can cause disabilities, they can cause handicaps in children, especially diseases like polio, because if these viruses attack us or our children when we are at a younger age, when the immunity of the child is not sufficient enough to take care, then there can be long lasting effects of the illness, like the child can be paralyzed for life in case he is affected by the polio virus. Similarly, in case of measles virus, if we don't take the measles vaccine, then sometimes there can be long lasting effects, like it may arrest the development of a child, it may cause memory losses, it may cause cognition defects. So it is always better to vaccinate. Some diseases can be life threatening, and if the vaccines are not given on time, then they may cause deaths also, like we have seen many times in cases of tuberculosis. All it takes is a small, simple shot that is given to the arm at the time of birth, and the child is free for life. Nowadays, we have also seen some vaccines which protect against cancer. For example, the HPV vaccine, which is the cervical cancer vaccine, protects against cervical cancer. So, almost 50% of cervical cancer, which is seen in women, is because of the HPV virus. Taking this vaccination on time can prevent a lot of our young females from contracting this deadly cancer. We should not worry about how the vaccine is, how can such a small dose help the child to prevent the illness. So a lot of research and a lot of deliberation goes into the preparation of that small vial that you see. It is a very lengthy procedure, a lot of research is done, lot of approvals, lot of trials are done, and only then they are approved by the regulatory bodies to be given to the child. Many people think that is it better to get the disease rather than giving the vaccine? Will the disease give natural immunity? Well, I don't think so. Why should a child suffer from an illness, be sick for a period of 8 days, 10 days, and then get lifelong immunity when it is much, much simpler to just take the injection and or the oral drops and be free in a few seconds? One should also not worry much about the side effects of vaccines. Many parents worry that is the vaccine going to be very hard for my child, or is he able going to be able to tolerate it, or what if he gets fever after taking the vaccine? So most of the vaccines do not give fever. Some vaccines are known to cause a little soreness at the injection site, which can be tackled by just putting some ice application or gently doing some ice massages. In case the child gets fever, it can be easily cured by giving paracetamol for 1 to 2 days. So these minor side effects should not act as a hindrance for taking the vaccination. It's very easy to deal with it. Many diseases can be prevented by taking the vaccines, that is tuberculosis, measles, chickenpox, polio, diphtheria, hepatitis A, hepatitis B, jaundice, typhoid. So, yes, vaccinations as much as possible should be done on time. Many people feel that when there are certain illnesses which are not prevalent in one region and are more prevalent in another region, so then should the child take that particular vaccine? Well, if you are destined to travel to that area, or you may come in contact with people staying in area which is endemic to certain diseases, it is better to take the vaccine. And if there is not much chance of travel, then it is okay to avoid that. But it is always better to take all the vaccines. Should we delay the vaccines? Mild delays for up to 10 to 15 days are fine, but a lot of delay should not be done. Should It is always better to follow a regular schedule. Most vaccines Maximum vaccines are given in the first year of life, and then some of them have booster doses which are given at a later stage, because with time the memory of the cells becomes less, and so we boost up the immunity by giving few booster shots maybe in the second or third year, which should also be taken on time. Uh, Dara here is asking me what is the importance of immunization in children. So, importance of immunization in children, yes, is that the child will not fall sick time and again. Like we all see in the monsoon, that recurrent cold and cough, child is coming every 15 days, every 20 days. So, if the flu shots, for example, are taken on time, then it can prevent a lot of flu related illnesses. If the pneumococcal vaccine is taken on time, it can prevent diseases like pneumonia, which have potential complications later on. So that's why it is important to take. Sometimes when you don't take the vaccine and you get infected by the particular virus, it may not cause symptoms initially, but later on the virus may remain in the body, and when you are an adult, it may show on some symptoms. We have also seen mass immunization programs in our country, like, for example, the polio drive, which is very common. All of us are aware with Do Boon Zindagi Ke. So, why not? When just taking a few drops is going to save you from paralysis or being handicapped for the remainder of your life, why not just take those 2 drops and encourage everyone around to take? It is always better. What about resistant strains is what Mr. Mehul Mistry has just asked me. So most vaccines cover the common strains. So whichever strains are known in those particular continents, vaccines are made in that way. Okay, they can attack those strains with time. As research goes on, and as we come to know of new strains that are resistant, sometimes the make of the vaccine also changes. Like, for example, in flu, every year or every 6 months the vaccine strain changes, because we see changes in the structure of the vaccine. So many vaccines get modified from time to time and help to tackle these resistant strains, but there are a few which may not be coming under the cover, but maximum do. Uh, Also, Mr. Mehul Mistry has asked me another question: till what age immunization should be given? So, immunization routinely goes on till 10 years of age, maximum vaccines being in the first year of life. Second year, mein many boosters are there, then annual flu shots are there. 10 years is the last that we give the DPT booster, and then sometimes at 15 years also. In some people who have special conditions or are immunocompromised or are beyond a particular age suffering from certain illnesses, they may need to take immunizations even beyond the age of 60, but most of it stops in the early childhood. Also, when not to vaccinate, we should also know when we should not vaccinate the child unless and until a child is suffering from an active illness. That is, if he is sick at the time, like he is having some fever or some illness like some cough cold or a tummy upset or some active evidence of active infection in the body, that time vaccination should not be given. Once he is out of the woods, out of the illness, then the vaccine can be administered. Sometimes the person or the child is on certain medications during which the immune system takes a hit. So, if you give the vaccine at that time, the body may not be able to respond properly. So, in those cases, the vaccines have to be delayed till the treatment is off, and then the schedule can be continued. So, I don't think that we should delay much about the vaccines. Anything else? Anybody? Should my child get shots if she's sick? Yeah, I think I have also spoken about that. That once the child has recovered from the illness, she can take the vaccination. Any more questions? So, to summarize, I would like to say in a nutshell that we should be wise and immunize on time to prevent ourselves and our children from getting the deadly viruses or the bacteria, any infection which can be easily prevented. And it helps us to live longer, helps us to live a healthy life, helps us to take part in all the activities, and does not affect our lifestyle a lot. So I think that yeah, this would be the take home message from my end. We here at Surya Hospitals regularly provide all the immunizations, and it is done on a daily basis. Feel free to walk in whenever, and we can complete the vaccination schedule for your child. Thank you.